A 68-year-old patient from South America was discovered to have an incidental right middle cerebral and basilar tip aneurysm. She was otherwise healthy and had a family history of intracranial aneurysms. The angiogram from her home country shows the middle cerebral artery aneurysm and the basilar tip aneurysm. Each of these are better seen on the three-dimensional angiogram, which shows the irregular middle cerebral aneurysm and the basilar tip aneurysm. Neurosurgeons in her home country had recommended surgical clip ligation of the middle cerebral aneurysm and endovascular treatment of the basilar. She had been referred for a second opinion, and we suggested both aneurysms should be treated with one exposure. After doing a right frontotemporal craniotomy and widely opening the sylvian fissure, you can see the middle cerebral aneurysm is exposed, but we chose to clip the basilar first so that the clips from the middle cerebral do not obscure our view. Here we are operating in the carotid oculomotor triangle and opening the membrane of Lilliquist. We now see the posterior cerebral artery, and that is followed back to the basilar bifurcation where we see the aneurysm. Notice that no fixed retractors are used. The retraction is all dynamic retraction with instruments. There is a perforator lying right across the dome of the aneurysm, is carefully swept out of harm's way. We're looking across the anterior aspect of the basilar tip aneurysm at a perforator off of the contralateral P1. And then a straight clip is placed across the neck of the aneurysm, again making sure that the perforators are completely out of harm's way, looking behind the aneurysm as the clip is slowly closed. Once the aneurysm is clipped, micro pickups are used to carefully inspect around the aneurysm to be absolutely sure no perforators are compromised, and we coagulate the dome of the aneurysm to shrink it away. Now we can direct our attention to the middle cerebral artery aneurysm so that the clips from this would not have obscured our view of the basilar tip aneurysm. Because of the shape of the aneurysm, we chose to use a shank clip. This clip is placed over the dome of the aneurysm, across the neck, and then suction used to suction the dome up into the clip to try to obliterate the entire aneurysm with one clip. Once it's clipped, we carefully inspect under the microscope, and then ICG video angiography demonstrates patency of both M2 branches. But it does show that there's a small dog ear just at the distal end of the clip that you can see here. And to obtain a more perfect result, a fenestrated clip is used to clip that portion of the aneurysm that was left from the original clip. At this point, we perform intraoperative angiography, which documents complete obliteration of both the middle cerebral and the basilar tip aneurysms and normal filling of the surrounding vasculature.